25 active cases of coronavirus in Victoria today. That's 0 locally acquired or hotel quarantine cases in the past 24 hours. Some 8,277 cases, results came in yesterday, all negative. There is still 1 case in hospital out of those 25, and we wish that person a speedy recovery. Just for the record, the department is just seeing out 2 indeterminate results for 2 hotel quarantine workers that came in over the last 24 hours, one at the Novotel and another at the Pullman. These initial indeterminate results through saliva testing were then followed up with PCR results, and out of an abundance of caution, some intermediary measures were taken place around each of those places of work and immediate contacts until such time as those PCR tests were then followed up. And the good news is that those 2 PCR tests were well and truly negative, and those public health responses have subsequently been turned down. That just goes to show the very risk-averse nature of the manner in which those daily testing results of all CQV staff are dealt with, really risk-averse, minimising any possibility of transmission exposures. We are currently managing and monitoring and testing the remaining primary close contacts associated with the Holiday Inn cluster. For a 3rd straight day, the number of new contacts notified the department within the 48-hour benchmark met the 100% mark, and that now runs over the course of the last week at 99.9% for that period of time. I'm pleased to say there were no further exposure sites listed, and of our current exposure sites, we're advised that some 546 people associated with the Terminal 4 Melbourne Airport's exposure site have been reclassified, and we thank those people for the isolation and the support that they made sure that not only were they keeping themselves safe, they were keeping their families and all Victorians safe. We're continuing to work through the remainder of that Terminal 4 large group of people over the next few days. And we're also now well and truly into a whole range of day 11 and indeed day 14 tests for those clusters. 11 of the 25 people associated with the Brunetti's workplace site have tested negative on their day 11 tests, and we're expecting the further results for those day 11 tests today. All the primary close contacts associated with the Glenroy exposure site at the Kinder have tested negative on their day 11 results. The nearby Early Learning Centre in Glenroy start their day 11 tests tomorrow, and the day 11 tests, including the large number of students from St Aloysius Primary School in Ballarat for the Queen Victoria Markets exposure site, commenced today. And all of the people associated with the Sydney Road private gathering, all of their day 11 tests have come back, and they are all negative. Given the number of cases linked to that site, we are ensuring that their day 14 tests are part of their quarantining processes, given the wildly infectious nature of the UK variant. And of course, all 17 of that group came back negative. In regards to testing, our testing numbers were stable for this weekend, with no sites reporting waiting of more than 30 minutes. We've now got 14 sites operating extended hours, and those hours will continue to be maintained and reviewed subject to ongoing demand. Our rapid response testing teams are now being redeployed to the large number of people who are seeking testing in those day 11, day 14 testing arrangements for quarantine and isolation in their private residences. But today is really a good day. Today is about the first day in the comeback to the end of this global pandemic's ravaging of our nation and our community. Today, the Commonwealth-led COVID vaccine program has commenced in Victoria. It started earlier this morning in hospitals just like this one and in settings just like this. And for people like Grace and Chris, Grace, a frontline healthcare worker here at the COVID screening clinic at the Austin, and Chris, a mental health worker at the CQV hotel system, they are the real heroes of the past 12 months, and it's only appropriate that those people who have put the most on the line get first in line when it comes to the vaccine program. And it was a really exciting moment for them and their colleagues to start this process here at the Austin. They are amongst the first of Victorians to be protected from this hyper-infectious virus, and I want to make sure that the nature of their work is recognised as how important it is that those frontline workers, together with the other areas of the program that the Commonwealth are looking after, people in residential aged care and disability settings, those really important groups of our community who are particularly vulnerable to the COVID-19 vaccine are at the front of the queue. We're very proud and pleased to be working with the Commonwealth to make sure that this program prioritises those higher risk communities and work groups first. People who work in those high risk locations like Chris and Grace, and make sure that they and their colleagues, and through them their families, are all protected. These are the Victorians who've been on the front line keeping us safe throughout 2020, and they will be leading our response over the next few months. As the Prime Minister has indicated, this national program rolls out from now to October. I want to make sure that we all want to make sure that this program gets us back to as close as to a normal life as we can for our community. What this program does is add to our public health toolkit of all the measures that we need to be able to respond to making sure that this is the beginning of the end of this global pandemic here in Australia. And vaccinations have started today at hubs like this, here at the Austin, at Monash Health, at Western Health and at Barwon Health, and through them a number of other hubs associated with partnering between Monash and the Alfred at the airport, and through Barwon Health out to a number of public residential aged care centres. And we will see this program grow over time as situations like here at the Austin, where Dr. Janine Trevelyan, the Clinical Director of COVID-19 vaccination programs here, looks to the next stage after we look after the workforce and vulnerable communities. Facilities like this become community vaccination hubs, and we'll more than happily explain those should you wish to. I'd really like to now introduce Professor Ben Cowie, who is the Senior Medical Advisor to the Victorian Government on the rollout of the vaccine program. This is a significant and complex program that will be the largest logistical medical program in our nation's history. It is also the most important program. Led by the Commonwealth, supported by all the states and territories, this is about the first step in a pathway out of this pandemic. It adds to our public health toolkit. It makes sure that we are in a position to look to life on the other side of this pandemic. There is still some way to go. This program, as the Prime Minister has foreshadowed, will run to the end of October. We will still need in place measures to protect us from the importation of the virus globally. We will need to maintain social distancing and hygiene arrangements as we go around, slowly getting back to the kind of life that we all look forward to again. In this period of COVID vaccination programs, a program that is safe, that is thoroughly and rigorously tested right around the world. Over 200 million vaccinations already in the arms of people right around the world, starting here today at the Austin and at the Monash and at the Western and at Barwon to begin that pathway to recovery. So I might introduce Ben, and we'll be happy to take questions after that.
Thank you so much for that introduction, Minister. It is really exciting to be here today on what is a historic day for Victoria and for the nation. Perhaps if I start by just touching on a few points that the Minister made. These vaccines are safe, they're effective, and they're free. And all eligible Victorians will be able to have these vaccines over the course of this year. So when we say these vaccines are safe, we're saying that they've been tested initially in clinical trials which involve tens of thousands of individuals and have subsequently been administered, as the Minister mentioned, to tens of millions of people worldwide. And that's just the Pfizer and AstraZeneca vaccines that we have available here now, and the Pfizer vaccine starting today, and then the AstraZeneca vaccine coming online as soon as we get doses available in coming weeks. So these vaccines are very safe, and they've been through an incredibly rigorous approval protocol administered by the Commonwealth's Therapeutic Goods Administration, or the TGA. So no medicines or vaccines are authorised or approved for use in Australia without that incredibly rigorous safety protocol. Secondly, they are indeed effective, and there's been a lot of commentary on the effectiveness of these vaccines in a range of places. So we know that both the Pfizer vaccine and the AstraZeneca vaccine are extremely effective at preventing serious illness from COVID-19, and indeed incredibly effective at preventing people from losing their lives, which has to be a fundamental objective of any public health program. There's emerging evidence from countries which have already vaccinated significant proportions of their population that the Pfizer vaccine certainly prevents transmission of COVID-19 also. So we've got the first real evidence that not only are we preventing disease, but that we're preventing infection in the first place. And this is really exciting. And we expect more evidence for both the vaccines and indeed other vaccines that have been rolled out in coming weeks. And indeed, they are free. So all Australian citizens, residents and temporary visa holders are eligible for free vaccination under this Commonwealth program, which we're excited about the implementation of here in Victoria, starting with these fantastic hospital immunisation hubs, including the Austin here today. And it's been such a wonderful opportunity to see that start. So as the Minister said, the initial priority for vaccination is part of a national prioritisation process, which has public health and clinical evidence at its heart. And the first people to be vaccinated today are the frontline workers that, as Minister Foley mentioned, are the people who are out there keeping us safe every day, whether that's in our hospitals or indeed in our hotel quarantine program or at our airport. And by keeping them safe, we keep the whole community safe, because this is part of us increasing the armour, if you like, for Victoria against the incursion of COVID-19. So as the program rolls out and as more doses of vaccine become available, both of the Pfizer vaccine and the AstraZeneca vaccine, those priority groups will expand and we'll be able to scale up the program to cover every eligible Victorian over the course of this year. And I guess I'll just close by saying a big thank you on behalf of clinicians and also on behalf of public health practitioners in Victoria for everything the community's already done. I think the COVID-19 vaccine program, as the Minister has mentioned, is a really fundamental tool at transitioning us from where we've been over the last year towards a more normal life going forward. But it's only one tool, and it's really important that we continue to retain public health capacity to respond to cases, we keep those testing levels high, and we protect our health system to respond to the needs of Victorians who may get COVID-19 in the future. But today is a really exciting day because we have a fundamental new tool in our armamentarium against this virus.
What would you say to those people who booing last night at the Tennessee signature full confidence for the vaccine?
Well, I certainly heard a lot of cheering as well. And so I think if I don't presume to speak on behalf of the Victorian population, but I'm certainly cheering the start of the vaccination, and I think there's probably a lot more people at home who are cheering than booing.
How do you combat that? How do you tackle that?
It's totally understandable that many Victorians have questions about the vaccines and about the program, and I'd encourage people to express those questions and their viewpoints in a peaceful and respectful way, in the same way as we're seeking to engage with the entire Victorian community and all of our communities around questions like safety and efficacy of the vaccine. So I think we need to meet people who are hesitant and to talk to them and hear their concerns. Ultimately, this is all based on the best scientific and public health evidence. And I guess the final point, the proof in the pudding, if you like, is seeing the reduction in infections and deaths happening overseas in countries which are achieving high vaccination levels. This is not just stuff that's happening in clinical trials or in laboratories. It's happening in real people worldwide, and it really is it's a fantastic step forward. So I think we need to give the evidence, but we also need to understand there's reasons why people are hesitant, and we need to address those.
With the vaccine phases stuff, this will start progressing through those stages. It's being administered to the general public. How do you identify, I guess, people who aren't in the system who might be exposed to it, and there might be something like that?
So the first and most important step to identifying people who might experience lesser degrees of access to our health system or who might seek information in different ways is making sure that not only are we talking to the entire community and all communities that make up this fantastic state of Victoria in a way that's appropriate and respectful of the way they prefer that communication to occur. So I'm thinking about the use of community leaders, clearly the use of resources in language, the use of faith leaders as ambassadors for the vaccine program, and we've done a lot of that work already with many fantastic faith and community leaders who have taught us so much about how we can be improving the way we engage with Victorians. I think the other part of it is listening, and actually listening to experts in the area, listening to those communities, listening to people who feel that they're not getting the messages they need, and taking their advice on how we can be doing better. So this really is, it's a conversation, it's two ways. It's not just about us broadcasting in a different way, it's about listening to community and making sure we're hearing those messages.
Do you think that having more people, seeing people from today getting the vaccine might have the effect of reducing that hesitancy?
I certainly expect that is the case, and as we see more and more of our frontline workers and people at highest risk of COVID-19 stepping up, getting vaccinated, and I'm sure their reactions will be as positive as Chris and Grace today, that they're sort of, that we will have more and more evidence that will, I believe you're right, reassure the community that this is a really positive thing for all of us, and the more of us that get on board with vaccination, the better we're all going to be.
The evidence about transmission rates, what's that telling you now?
Yeah, so the early evidence, and particularly I'm referring to some of the evidence coming out from Israel, which has vaccinated a very substantial proportion of their population already, is firstly that the actual rates of infection in those vaccinated are going down. It's not just about illness, it's about infections. But secondly, and just as importantly, and it's important to mention, like much evidence in the last year, this still has to be properly peer reviewed, etc. So there's a process that has to be gone through. However, by day 12 after the first shot of vaccine onwards, even if people do get COVID-19, the amount of virus in their system is significantly less, which also speaks to the capacity of that virus to then go on and infect others. So even for people who do get COVID after the first shot, we're seeing a significant reduction in their infectiousness to others. So it protects against infection, it certainly protects against serious infection, and furthermore, we're seeing the first evidence that even amongst those infected, it reduces its ability to spread to others. It's really exciting news.
Do you have any concerns that there will probably be bumps in the road in this rollout, that there might be issues with stock at some point?
So as the Minister mentioned, this is the largest, I guess, public health and medical exercise in Australia's history. There will, of course, be hiccups. You can't roll out a complicated program like this without having issues like, for instance, stock availability or people's appointments having to be cancelled because of staffing issues, etc. I'm very confident that those will be ironed out as the system matures. I'm also really confident with the kind of fantastic healthcare workers that we saw in action today here at Austin, that our health system is one of the best in the world, and our clinicians and right through the entire healthcare workforce are so well trained and so capable that those sort of hiccups, that's an everyday occurrence. They'll manage it and we'll move on.
There are a lot of people who have concerns, not necessarily anti-vaxxers, that have different perspectives. There are a lot of concerns with women around fertility and pregnancy. What's your advice around those?
So the advice for instance, women who are planning pregnancy, women who are already pregnant, or women who are breastfeeding. So there's Commonwealth advice that's been approved by both the Commonwealth Government and by ATAGI, the Australian Technical Advisory Group on Immunisation. That information is available on the Commonwealth website, so I'm happy to go through it very briefly. I would say that people should look at the website to get the details, and also the most fundamentally important person and source of advice for anyone about their health has to be their doctor. So everyone should be speaking to their GP about the vaccination program if they've got any concerns at all. But ATAGI, the Technical Advisory Group on Immunisation, have come forward to say that these vaccines, or certainly the Pfizer vaccine I should say, is safe in the setting of breastfeeding. They have also said that in the setting of pregnancy, whilst we're unaware of any adverse effects at this point in time, the vaccines have not yet been tested in pregnant women to the point where we can routinely recommend their use in pregnancy. Furthermore, for women, but however, there is no limitation on a woman who is seeking to become pregnant having the vaccine. It has no effect on fertility whatsoever.